Welcome to Close Up Radio, where our hosts, Doug Llewellyn and Jim Masters, bring you the amazing stories of people who answered the call to unlock their potential and taken control of their own success with authenticity, creativity, persistence, and resilience. Close Up Radio special guests share their knowledge and wisdom so you, the listener, can live the most empowered life possible. Close Up Radio. And now, here's today's host, Jim Masters.
Thank you very much for joining us, everybody. We're live worldwide on Close Up Radio. It's 2 p.m. Eastern here at the Broadcast Center, and a pleasure to have you here, and also a pleasure to welcome and to highlight radiation oncologist Dr. Sophia Edwards-Bennett, based in Tampa, Florida, known affectionately to patients as Dr. E.B., an exceptional radiation oncologist and cancer authority. She has been honored as a top doctor locally and international, and in a number of Who's Who editions, and was featured on NBC and Fox and the Success Network as well. She's practiced in 2 countries in numerous states, and she's trained in incredible facilities serving on breast cancer and therapeutic radiology advisory committees, doing extensive research into oncology therapeutic agents, and founded a philanthropic organization oriented to lupus. She's also become a speaker as well. Dr. E.B. first became interested in the medical field at a young age when she saw how disease affected her mother and their entire family dynamic. Her mom had lupus, and one particular doctor who treated her mom stood out. And this was the kind of professional she aspired to become herself, holistic and compassionate. It lit this fire in Sophia and led her to her current career. And today, she is known for saving lives while transforming minds. Dr. E.B.'s experiences have been integrated into a 7-pronged approach that she calls the Big C Reattitude. Dr. E.B. expounds her philosophy to patients, telling them that cancer is not a stop sign, as they might think. It really is a yield sign. She also discusses the philosophy as a best-selling author, and in a series of YouTube podcasts, which I think is really incredible, Revelations from the Oxymorons of Life. We're going to talk about that, Revoxa Life, in the podcasts. And it's our pleasure here on Close Up Radio to talk with Dr. E.B. and hear more about her mission, background, treatment approach, and inspiring ideas as we welcome her here live from Tampa, Florida, on this episode of Close Up Radio. Doctor, welcome to the show. It's a pleasure to have you with us, and thanks for joining us today.
Thank you, Jim, for having me, and indeed, it is a pleasure for me as well. So the sentiments are definitely reciprocated.
Thank you. I appreciate that. And for the purposes of the show, I will definitely refer to as Dr. E.B. I love that. I think that's really, really cool. And we have a lot to talk about in the 30-minute window that we have. But first, I did want to go back to some of your own early on inspirations, your own life's journey, and even back further to the childhood when you were first realizing that you wanted to get into the medical field, and now it's not just a matter of want to be in it. You have to be in it. It's a part of who you are, helping others.
Definitely, and that's certainly true. And in fact, as we all know, as we gain wisdom from just life experiences, we know that our experiences certainly inform our present and our future, right? And so that is exactly what occurred in my life, wherein I was a part of not just the observation, but the assimilation of knowledge and wisdom from the doctors who treated my mom. So just to honor brevity here, my mom was diagnosed with lupus and actually died of lupus when I was 13, and there were 3 siblings for my mom, and my 2 brothers were also teenagers at the time. And what struck me during the 5 years of my mom just battling with lupus, given that it was actually in Jamaica, third world country, and in that area of the world, in addition to the time when she was diagnosed, there was not really any promising treatment. And so you can imagine the multiple flares and how she was actually treated. In terms of the therapeutic interventions, those were stars, right? And so what occurred, and what I was impressed by, were two things. My mom had this really strong faith, and that was really what balanced us, because prior to even her illness, our family was in some turmoil, and there was a lot of, her life was pretty rugged, and there was a lot of restlessness, to say the least. And so that predated her actual diagnosis. But even so, she was the stabilizer. She remained strong in her faith. And so when the physicians, there were two physicians in particular, Dr. Kataya and Dr. Cupidor, they were the main physicians responsible for taking care of her. And because of her strong faith, my mom, when the doctors would visit her of course, they would examine her. And even with her family, friends, visitors, she always had these encouraging words to expound. I mean, she was the one who was ill, but she was always just divulging some words of wisdom and encouragement. And I think that really impressed the physicians, right? And so there was some requited admiration there, right? Because she was really, her faith was impressive, but also they were great physicians, and not only did they take care of my mom in a very special manner, but they actually conferred with us, the children. We weren't just, bystanders. We were involved in her care, and the physicians actually conferred with us, encouraged us as well. And so those were the two things, the requited admiration, which they actually expounded. They explained to us and explicated many times how much they admired my mom for her strength and her faith and her courage. And they did not have to do that. And they were also interested in how we were doing, how we were coping. And I think that really impressed upon me this collated version of a physician who not only addresses the illness but goes beyond that to include the family and to heal not just the illness but what is happening beneath that, what is occurring to affect how we cope with the diagnosis, and not just the patient, but the family. And that all-encompassing approach was what I admired. And so I carried that with me. But as you know, when we go through life, right, the observation, right, and the assimilation is the first step. But the revelation comes after, right? So I lodged that in my gray matter. And I carried on with life, knowing that was my inspiration, knowing that in the future I would likely become a physician and practice as such, of course, dovetailed with everything else that I would learn in the future.
It's so fascinating. Wow. What revelations and inspirations you've had, Doctor, along the way. You also studied at prestigious facilities such as Harvard Medical School and Memorial Sloan Kettering Cancer Center, extraordinary facilities, educational institutions. Can you tell us some highlights of your medical education and experience? And even, for instance, you once had this extraordinary task of launching an entire new radiation oncology department as well. So that's quite an undertaking.
That is quite an undertaking, but it was also I was quite honored, actually, because I'm not sure if that is known to everyone and certainly all our listeners, but this undertaking was executed in Jamaica. So I was born in Jamaica. I think I alluded to that earlier, and I grew up there, but I trained, as you stated, in the U.S., and I was given the opportunity to launch a Radiation Oncology Center in Jamaica by the government. And this was spearheaded, as in my recruitment was spearheaded by Everton Anderson, who is the president of NIH there. And it was basically full circle, right? Because I gained all my knowledge in Jamaica, so to speak, the foundation, that is, right? And then my medical education in the U.S. And then I was able to give back to Jamaica. So honestly, it was quite a providential experience, I have to say, and I was quite honored. In terms of the highlights of my medical education, it's interesting you asked that question because the highlights precede that as well, right? Because I believe in divine intervention, and I do believe that there are turning points. There are these milestones in our life. There are these forks in the road where we need to make a decision, and we have what I call disguised and dispatched people, disguised and dispatched as people, but they're really or guiding angels. And so I entered the medical field actually after completing my PhD program at Georgia State University. And how that occurred is after my undergrad education in Jamaica at the University of the West Indies, I received communication from one of my professors there that there was an opportunity to pursue my PhD in the U.S. and his connection or his colleague was actually a professor at Georgia State University, and I'm not sure why I was chosen. Actually, as I said, I mean, these things are ordained, and I can't believe otherwise because of how it has occurred and just materialized. And so he encouraged me to apply for this, for the PhD program, which is fully funded. And I did so after taking the GRE, et cetera. And of course, I was admitted. And interestingly enough, the project, after being presented with multiple projects, I was intrigued, really, by a project involving the synthesis of DNA intercalators. Now, these are anti-cancer agents, right? They're used as anti-cancer agents. So in delving into, the science behind DNA intercalators and, reading all of these publications having to do with how these are not only synthesized but employed in oncology, that then I became more fascinated with medicine, and that reignited my interest in medicine. So then, of course, after gaining my PhD, I set forth to obtain a medical degree. As you know, I went to Cornell, and then because I knew that I was interested in oncology, I sought to gain some clinical experience in my first year, which is not very common. Usually you wait until your third year to gain this clinical experience, and it's mostly just academic, classroom experience before that. But I was so interested in gaining this, and I was literally across the street from Memorial Sloan Kettering. Literally, the proximity was across the street from Cornell. Cornell was across the street from Memorial Sloan, and therefore vice versa. And I sought out Harold Portlock, who was willing to have me shadow her in clinic. And then in the summer, she did not have and she's a medical oncologist, but she did not have a research project, and I was really interested in the summer research project to see. She introduced me to Dr. Akialam, who is a radiation oncologist, and the rest is really history. He was actually the physician and he's a nestor in the field, actually. He referred me and actually provided reference and recommended me for the Harvard program. And that is how I gained that experience in the Harvard program for therapeutic, oncological, and research studies. So that is it in a nutshell, really. I could literally expound much further, but that is it in a nutshell. Yep.
That's quite a nutshell.
But it was, it's a large nutshell.
Yes.
But it's small in comparison to what it could actually be, is what I'm saying. There's more.
This extraordinary development of the 7-pronged approach to living with the psychological side of cancer as well. Your big C Reattitudes philosophy. Let's discuss that. That sounds to be something so impactful, beneficial, and so important in our lives.
Yes, indeed. In life, and certainly applicable for my cancer patients, but as you stated, in life in general. So I developed the Big C Reattitudes to really address the psychological toxicities that are experienced by my cancer patients. And in practicing for multiple years, I realized that these toxicities were not being addressed. And I actually, after much rumination, I came to the conclusion that there were certain algorithms that I was not really formally, I did not have a formal name for that, but because of my experience with the two physicians, as I spoke about earlier, I realized that really was informing me, which is why I made that statement, right, about the revelation. It comes later, right? So I was practicing that, but I did not have a formal name for it. And so I really dedicated some time trying to formalize and just dig deep into how I could collate all of these elements. And so once I was able to do so, I recognized that there were actually 7 elements. And so it's called the Big C Reattitude because, of course, the Big C is cancer. And then the Re, that's actually the embodiment. This is how it is enacted. And the attitudes are the elements that I want to foster, inspire in my patients, right, or cultivate in my patients. And so the Reattitudes are, I have an acronym. It's actually HIS LAMP, HISLAMP. And so the H is for hope, the I is for identity, the S is for self-worth, L is for life, and the A is for admiration, M is for mind, and P is for purpose. So those are the elements. So the Re, which is really the execution or the enaction of such, right? That's the restoration of hope, the reclamation of identity, the reacclimation or the restoration of self-worth. And then the LAMP, the L is reappraisal of life, A, requited admiration, M, rehabilitation of the mind, and for the P, reignition of purpose. So those are the 7 elements, and I'm not sure if anyone listening is spiritual or religious or a believer, but 7 is known in the Bible as the number of completion, right? Now, interestingly enough, I did not have that acronym when I formulated this algorithm, and I was just thinking about how I could improve upon it, and I saw the words, his lamp. It was about 2:30 in the morning. That's usually when I'm mostly active and delving in my thoughts about how I can improve patient care, cancer care, etc. And I thought about the verse in the Bible which states clearly, thy word is a lamp unto my feet and a light unto my path. And so in my book, Higher Ground, once I explain the Beatitudes, I actually quote that scripture because that is the scripture that occurred to me directly after I recognized that these elements actually represent or can be represented by the acronym HIS LAMP. And so I instill these Beatitudes in my patients, but you see, it's not really a set formula, so to speak, because as you can imagine, my patients present at different stages in their lives and in their actual acknowledgement of their diagnosis, right? So it's like the stages of grief, right? And every patient is different. They're presenting really packaged in their past, their present, and of course what they hope for their future, right? That's how I see my patients. So I don't see my patients as just, a patient with the diagnosis of cancer that I need to treat. I'm well equipped with that knowledge to treat them, but I cannot just treat the disease, you see. I have to treat what also affects them surrounding the disease, right? So it's not just the disease, but it's in the periphery, right? These are the things that they have to deal with in addition to the diagnosis. And there are actually studies that show that that psychological toxicities actually, or the psychological state of a patient can affect the outcome. And of course, there are confounding factors. For example, if a patient is anxious or fearful, maybe because they had a family member who underwent treatment and expired, then they have a heightened level of anxiety, right? So I do have to address them where they are. So every patient is different, and so it's a customized approach, therefore. And so what I do, in addition to just explaining the treatment algorithm, I need to go beyond that by first ascertaining what they think about the disease, where they are psychologically. And of course, that doesn't happen in one setting, right? I mean, there's several visits, and it really depends on the patient, how open they are to express these things, right? I can tell you, for example, I had a patient who was really not he was quite reticent to proceed with radiation. And after eliciting more information about his home life, etc., I realized that there were confounding factors without saying much else or divulging much information. And I then organized a team to address these issues so that it would be much easier for him to be more compliant with treatment. And so once that burden was relieved, then he was no longer as anxious. Of course, he's anxious about the diagnosis, and he's fearful about the treatment and its effects, etc., the side effects, which they all have to deal with as well. It's not just for the cancer, but the toxicity from the treatment. But once that was settled, he was then able to breathe and just deal with the treatment at hand. And so that's just one example.
I love that.
Thank you.
Now, in addition to reaching patients, your way of treatment really does reach families. What are some of the things you tell them, or that they might tell you about dealing with a loved one who has cancer? I think I heard something about, of course, making plans and having a future, things of that nature as well.
Yes, indeed. So it really ties into the big C attitudes, right? So I can answer that question by giving you another example, just explicating, the path that sometimes we have to take to get to the patient's vulnerable side. Every patient has that vulnerability that they don't want to be exposed, right? And so I have a patient who, for example, he was very stoic initially and had a prognosis that was not very, very good. And his wife accompanied him to all of his sessions for treatment. And I'm always interested in the family dynamic. So, of course, the first thing I do, I want to know how the patient is doing, but I also want to delve into how the spouse is coping. I ask about support system. How are you dealing with this? Do you have friends, etc.? Because what we have to understand is that everyone is going through this. Now, the patient is the one that is undergoing the treatment, etc., and is facing their mortality, but it's not this. The spouse isn't distant from all this, and it affects the entire family. So I usually address that with the spouse or any family member who accompanies them. But this particular couple had a young son in his 20s, and he was never at the appointment. So I inquired further. I wanted to know how he was spending his time, and because when you're an adolescent or a young adult, you cope with these things differently. So he was spending a lot of time with his friends. They weren't quite sure how he was actually coping, but obviously one of the ways was to not spend much time at home. Now here's the thing, that's not necessarily healthy for two reasons. Because there will be regrets in the future if you're not, once he becomes old, when he's older and he reflects, right? So having the experience that I have had, which actually informed how I treat my patients, actually with my experience with my mom, I knew that it was very important. So I then encouraged the father to, engage in certain activities with the son, and also to encourage him to accompany him to some of the sessions just to get a sense of how he is coping with the diagnosis and what he has to go through, so that the son is aware that all the family members are aware of what the cancer patient actually has to endure. Because I think there is some intimacy there that needs to be established, some closeness that in the end, even if it is not a positive outcome, there will be a lesson from that. Because what I understand about this process is there is preparation for purpose. And even if the patient's prognosis is slim, as I have experienced, my experience was a preparation for my purpose. And so I can use the big C attitudes not just for my patients, but for their family members as well. And so what the family gains, even if it is a bad prognosis, can actually be used in their life for the future. And it can actually inform them. It can actually guide them in a certain path that they weren't planning to pursue.
I want to, got like 10 seconds left. I want to get the website in. Yeah, goes by fast. MyDoctorEB.com. MyDoctorEB.com is the website.
That is correct.
To connect with Dr. Sophia Edwards-Bennett. Dr. Edwards-Bennett, this was amazing, and it does go by so incredibly fast. Hopefully,
it's so
much
30
minutes.
I wanted to.
Well, we'll have to definitely have you come back, and we can expand some more. That would be an honor and a pleasure. But again, for those listening who would like to connect further, www.mydoctoreb.com. This episode is recorded in its entirety and will be archived, so folks will be able to listen to it in its entirety in full later as well. Thanks for joining us, Dr. E.B. It was really a pleasure.
Thank you.
I hope we chat some more down the line.
Thank you, Jim. It was a pleasure for me as well. Thank you so much.
You are welcome. You are welcome. And again, mydoctoreb.com. Also on YouTube, youtube.com/C/ and I'll spell it out, REVOXY, and then the word life, LIFE. You take care, you be well, and we'll chat again down the line. I would look forward to that.
Thank you, and thank you for all of the audience listening. Thank you so much for your attention.
You're very welcome. Enjoy the rest of your day, Doctor. And you as well, everybody. Your host, Jim Masters, here thanking you for your time this time. Till next time, stay tuned. I'll be back in just a few minutes with another amazing guest from around the world, celebrated right here on Close Up Radio. Till then, for all of us, take care and be well, and have a terrific day.
You have been listening to a broadcast from Close Up Radio, a division of Close Up Television Incorporated. For more information about our show and to be considered for future broadcasts, please visit closeuptelevision.com. You may also learn about us on social media and listen to us on podcast and internet radio. Thank you for joining us, and we hope that you have an empowered and productive day.